Hello, my name is Lynn Dunbrack and I am the Program Director for Connected Health IT Strategies for IDC Health Insights. So many of the trends that are driving connected health today are the same ones that are driving health reform. We need to do a better job of managing our patients with chronic conditions. Healthcare expenditures related to chronic conditions are 75%. And so if we can get control over those costs, we can certainly do a lot to move and rein in healthcare costs. Well, if you look at all of the applications that are out there on mobile health devices, if you look at the fact that we have personal health and fitness devices that allow consumers or members or patients to be able to collect their biometric data and feed that back to a care management system, back to a care manager who can help coach them, all this machine-to-machine connectivity provides great opportunities for big data and for analytics, because we really need to be able to separate out the signal from the noise. If our physicians and our clinicians are not to be overwhelmed by all of that data, they only need to see when patients are out of bounds. And so by applying analytics and big data technology, we can help them really see what patients they need to intervene with. Well, when you look at the fact that we can combine both financial data and clinical data in these big data technologies, in these data warehouses, it really provides us that opportunity of understanding which of our patients are the most sick. How can we control their health? How can we get them better engaged to be managing their health? And then look to see what those outcomes are. Did we actually reduce healthcare costs? Did we actually avoid admissions that can be very expensive? And so by that way, by getting consumers much more engaged in their health, understanding both their clinical data and their financial data, we should be able to improve overall outcomes, both financial and clinical, for healthcare organizations. I think when it comes to connected health, we really need to understand our consumers and who they are. Not all consumers are the same, even those with chronic conditions, so it's not like there's just a single population of diabetics. There are those who are newly diagnosed, who really need a lot of healthcare coaching. There are those who've been managing their illness for a long time and have been doing quite well, and you can tell by the fact that they are consistently doing their readings, they're managing their blood glucose levels. They're on the right track. And then there are those patients who may not be managing themselves very well. They may be dwelling in the valley of denial, if you will. And so how do we reach those patients? So I think really it's the consumer segmentation that our industry has not done very well, and I think that's one of the first places that we need to start when we look at consumer engagement strategies, particularly in using connected health technologies.